Thank you for joining us today for Eye on New Mexico. An important deadline coming up. If you haven't already signed up for health insurance through the Affordable Care Act, you only have until the end of this month to be covered for 2014. We've been talking about that a lot lately on the news, and my guest today, Deborah Hammer, the Chief Communications Officer for the New Mexico Health Insurance Exchange. Thanks for being here, Deborah. And we also have James Tomei, Vice President of HBW Insurance and Financial Services, Inc. Thanks for being here, James.
Thank you for having us.
We'll be talking more with them in a moment. I wanted to remind you all of an easy way to sign up for health insurance if you still haven't done so. The Health Exchange just unveiled a new way to enroll via text message. All you have to do is text BeWellNM to 311-411. When you text that, you'll start getting text messages with questions like, what's your household size and what's your income before taxes? Based on your responses, the exchange will then connect you to the appropriate resources to help you enroll. Now, after the March 31st deadline that's coming up, you will have to wait until October 1st to sign up for the year 2015. So this is a really important deadline, Deborah.
Absolutely.
Correct, yes. Well, start us off by telling us kind of what the status is right now. We know there was a report out just this past week that about 15,000 New Mexicans had already signed up for health insurance through the State Health Exchange and via the federally run website. What are you guys doing right now? How has it been going so far?
Well, we're really encouraged by the trajectory. We've seen some really good growth since December, but we know that there are thousands more New Mexicans who need health coverage this year. So we're really making a last-minute push and really seeing a lot of people getting interested since the deadline is coming up so close.
Yeah, I noticed that January you saw a bit of a fall off, and then it picked back up again in February. Do you think people have kind of started realizing, whoa, I need to get this done?
Exactly. I think, after the holidays, there's a little bit of a lull, and people thought they had more time, but, now with this being only 2 weeks, it's a really complicated decision. I think people are sort of actively looking now to see what's best for them and their families in terms of coverage.
Now, the Health Exchange, obviously these marketplaces, it's all new as part of the Affordable Care Act, and you've been on the job 6 months now. Of course, last fall, when we started to see the problems with the federally run exchange and the delays that people were experiencing and struggles trying to get signed up, what was the state exchange doing during this time, and how did that affect you guys?
Well, it was a little slow for the first 2 months because people couldn't register as well as they could through healthcare.gov. So we pulled back a little bit of our marketing. We didn't want to create more frustration. But now we're going full force again since the site's working much better. We created a lot of tools, including our New Mexico Care Compare tool on our website, because we knew people couldn't go to the federal website and really compare those plans. And now they can do anonymous shopping through BeWellNM.com. They can see what their subsidies might be, look at what their out-of-pocket costs or deductibles might be as well. So they can do this all on our website before they even have to go to healthcare.gov.
Excellent. And a lot of it is, how much of this is kind of pre-work that people need to do? Are there people who are still maybe out there wondering, do I qualify for this? What is your response to those people?
Well, absolutely. Well, we tell those people to work with an agent or a healthcare guide because, again, insurance is very complicated, even for somebody who's worked in the industry for a very long time. So we really encourage people to go on the site, start looking at what they might need, if they're providers in a network, what medications they might need so they choose the right carrier. We tell people not to just look at premium cost, but really fits their needs for them and their family. So you kind of have to go through all that stuff first. Again, work with an expert if you're confused, and then go online and enroll. And do that well before March 31st because we want everybody to have a really smooth experience and not wait to the last day.
Sure. We'll bring James in just a minute to talk a little bit about, he's the insurance expert here. But I also wanted to ask you, who are we seeing enrolling in the State Health Exchange? Are these people who haven't had insurance before through their workplaces? What types of families and people are we seeing?
Absolutely. The people eligible for the exchange are between the 138 to 400% of the federal poverty level. Those are the people who are really going to see those benefits, the tax subsidies and cost sharing reductions. So those are the people, not necessarily who have employment or insurance through their employers, unless it's deemed unaffordable. And if you have an individual plan that you like and they've grandfathered in, you can keep that rather than going to the exchange as well.
All right. James Tomei, as we mentioned, is the agency vice president for HBW Insurance and Financial Services.
That's correct.
And health insurance is one of the products you deal in, is that right?
That's correct.
So tell us about this. Well, first of all, I want to draw on your experience kind of in this industry. Has this new health insurance marketplace and the Affordable Care Act really changed things for you guys?
Definitely. It's kind of to a certain extent, turn the industry on its head because of the fact that there's a lot of miscommunication out there, there's a lot of misinformation, and really a lot of this is just kind of clarifying to people who is actually eligible for the exchange, because not everybody's necessarily eligible to get into the exchange.
Yeah, and what are the major misconceptions, and Deborah, if you want to jump in on this too, that people have? You know, who's not eligible?
If you have health care currently, or Medicare, something of that nature, then you actually do not have to participate in the exchange because you've got eligible coverage.
Sure.
A lot of people misunderstand that and think that people who are on Medicare, people who have VA insurance, or that type of insurance, or even employer-sponsored insurance, that they have to get the Patient Protection Affordable Care Act products, but that's actually not the case. If your insurance exceeds 9.5% of your gross income, then it's not considered affordable, and you can actually go to the exchange or the marketplace and shop for a plan.
See, these are all numbers that even I didn't know. The 9.5%, as you mentioned, that kind of gives you that threshold, like, do I qualify or not? Am I spending too much on insurance, or is this just normal? And I think you're right. And so, you know, a lot of what you guys have been doing is answering these questions for people. Is that right?
Absolutely. And we get a lot of questions too about Centennial Care, because there's the Medicaid expansion. So there's a lot more New Mexicans who are eligible for that as well.
Yeah, that's a great point. I'm sure you've had people that are coming and looking to sign up for the exchange, and they find out they're actually eligible for Medicaid or Medicare.
Exactly.
Okay.
Exactly. And if you're over 65, you're going to be covered by Medicare for the most part. So.
And lots of New Mexicans also covered by Medicaid as well, which was expanded, as you mentioned.
Right. We think 175,000 people could be added to the new Medicare or Medicaid enrollees. So let's get into some of the details of ahead of this March 31st deadline coming up. What do people need to do? What's the first step? Kind of quickly walk us through. You go to the New Mexico Health Exchange website. Where do you go from there? Well, it's bewellnm.com. I would look at the New Mexico Care Compare tool again and really start understanding what your subsidy could be. We're asking you a couple simple questions. You know, if you have a spouse, dependents, your income for the year, and that'll tell you what your estimated subsidies are. We have a calculator up there. And then again, you can go to the different plans, different carriers, look at the different costs, and I think that's the real first step. And then if there's any confusion, again, go to the experts, those agents, brokers, healthcare guides. We have them all over the state. You just go on our website and click on I Need Help. You put in your zip code, and you can find somebody in your neighborhood who can see you in person, on the phone, and it's free and confidential.
What kind of help have you been providing to people, James? What kind of questions have people coming? We went over some of those questions about what, you know, if you qualify, et cetera, but getting down into the insurance products, for example, what do people want to know, and what can you tell people?
Well, a lot of it, to tell you the truth, is education, because a lot of people, especially those who were newly eligible for the expanded Centennial Plan, for the first time are using insurance for the first time in years in some cases. I get a lot of people who are so extremely grateful for even just the opportunity to be able to have access to insurance. It's very quite moving. And a lot of people don't realize all the additional benefits that are now provided by the Affordable Care Act, such as preventative care, immunizations, diagnostic lab work, things of that nature, which in a lot of cases may not even impact their ability to pay that deductible, because the deductible does not necessarily kick in unless something major happens, which a lot of people don't realize. That, you know, if you have a major event like a, heaven forbid, an accident or hospital stay or something like that, that's actually when the deductible kicks in for most plans.
Yeah, that's a great point. I think people don't necessarily understand that there are these services, preventative care, as you mentioned, that they'll be able to take advantage of potentially for the first time for many of these people having health insurance for the first time. Now, are there different costs to people, different plans they can choose? Walk us through some of that.
Okay, the plans are broken down by metals. There's a platinum plan, which basically is a 90-10 split. The insurance pays 90%, 10% is borne by the member. And there's a gold plan, which is 80-20, silver 70-30, and bronze is 60-40. There's also a catastrophic plan for individuals who are 29 years of age or under.
That want the
But for a lot of those plans, there's additional benefits. Some plans offer gym memberships and things of that nature. So there's a lot of nice perks there that people don't realize that they actually have now.
Yeah, absolutely. And have you played a role also in enrolling businesses in this plan? We know companies here in New Mexico were able to enroll directly through the state's website. Has that been a big area of growth?
I think that there's still a lot of potential there. I think there's still a lot of employers who don't realize that there is a 35% credit this year, 2014, for them if they participate through the shop, and then in 2015 there's actually a 50% credit.
Nice.
In addition to their tax deduction.
Excellent. Well, we're going to continue talking with Deborah and James about this when we come back. And still ahead, young people have been a big focus of the new health care law. We'll talk to them about that and see how President Obama tried to appeal to the young people this past week. Thanks for staying with us as we've been discussing the important deadline coming up if you haven't signed up for health insurance through the Affordable Care Act. If you are eligible to get on through the exchange, you only have until the end of this month to be covered for 2014. And again, my guest today, Deborah Hammer, the Chief Communications Officer for the New Mexico Health Insurance Exchange, and James Tomei, Vice President of HBW Insurance and Financial Services. Well, this past week, President Obama chose a unique way to try and urge young people to sign up for health insurance. He appeared on comedian Zach Galifianakis' website, Between Two Ferns, this web show he does. And the president put up with a pretty offbeat interview to get his message across. The website Funny or Die, which hosted that interview, says it reached 1 million views within just a few hours of being posted. And in fact, we learned that website was briefly the #1 source of referrals to healthcare.gov. So this was a hilarious interview, obviously, that focused on many things, but really the reason the president did it was to talk about health care, and that the young people that he was trying to appeal to, those have been such an important part of the equation. Is that right, Deborah?
It is. It's really important that they sign up, not only for their own well-being, because we know young people are trying to move ahead in their lives, and one incident could cause them, financial disaster. And so we're really trying to get that message out. But also, that's just important to be covered, and we want to get this out, just like the president, in a funny, engaging way. That's really informative as well. And they're making right now about 20% of our pool right now for New Mexico.
The young people.
Right.
Wow.
The 18 to 36 crowd.
And that's a pretty good. And as James mentioned earlier, there are those higher level or catastrophic only plans that may appeal to someone who is a fairly healthy young individual, but still needs to be insured on, in case of the worst.
Exactly. And I've even set up some individuals, and with the subsidy, we've gotten premiums down as low as $40 or $50 per month.
Wow. So very, very affordable, actually, for hopefully for most people. And those subsidies, I wanted to quickly touch on that again. How many people are qualifying for subsidies? Are most people able to get quite a bit of help paying these monthly premiums?
Of the 15,000 people that have signed up, about 80% of them are qualified for some kind of subsidy.
So if you do think you qualify and are watching this right now, it's likely that you'll be able to get some help for that. Let's go ahead and hit on the things before this March 31st deadline that people need to know. There's a 24-hour hotline they can call right now. Is that right?
That's right. New Mexico has its own call center, so you don't have to go straight to the Fed call center. It's 24/7, bilingual, and the number is 1-855-99-NMHIX. And so they're always available to help, and if you don't know where you might fall, it might be Medicare, Medicaid, they'll refer you to the right area.
Everyone, and we'll have that number on our website as well. And we'll also be having a hotline here at KOB on Tuesday, March 25th from 5 to 7 p.m. During our newscast. We'll put the numbers on the screen. People can call, and you guys are involved in that as well. The Southwest Women's Law Center helping staff this hotline. And who can call? Anyone with any question, pretty much?
Anyone with any question. We've heard a lot of them, so we're very familiar with the top questions, and then if we don't know the answer, we'll get back to those people individually. But we're a resource for everybody who needs to come in, because we're very well connected with HSD and the other groups, agents, brokers, healthcare guides throughout the state, other advocacy groups that are trying to get the information out. So please, anybody call who has a question.
Excellent. Now, James, this deadline, March 31st, is really important because this is the last chance, as we mentioned, to sign up and have coverage this year.
That's correct.
The next deadline really doesn't help you until next year. Is that right?
That's correct. And during all this last few days, the last push, we've actually got a calendar on the Be Well NM website that lists all the different open enrollment events that we're going to be having between now and the end of the month. So that way people can take a look and find out what best is going to fit their schedules, and be sure to be at those open enrollments early rather than towards the end, because we only have a limited amount of time to be able to get some of these people enrolled.
And of course, under the Affordable Care Act, the law now is that people must have coverage. Now, the rules have changed a bit here and there. By 2015, will people, are we running up on a deadline where you know, if you're not signed up this year, next year's sort of the end.
Well, actually, there's going to be open enrollment every year.
Okay.
So this is a little bit longer since it's our first year, so we had a 6 months open enrollment.
I see.
Next year it'll be about 3 months. But the real important thing, if you miss the deadline for March 31st, there is a penalty, and it is $95 or 1% of your gross household income. So $95 doesn't sound too bad, but what if you're making $36,000? That's $3,600. So
Yeah.
why not get something or look for affordable insurance rather than just paying a penalty and,
For no
not having
reason.
anything?
Yeah, absolutely. And yeah, I mean, essentially, this was pretty easy to get signed up for. We've talked about the people who qualify. You know, I guess, again, tell us the last few things here that people need to know before this March 31st deadline. You know, how long does it take, this process now? I think, as you mentioned, people were kind of frustrated and scared away by those first months where the federal website wasn't working. Right now, how is the process working, and how quickly can you kind of get on and get it done?
Absolutely. Well, it depends how prepared you are and how much homework you've done on the front end. But we've heard as little as 20 minutes sometimes.
Wow.
Sometimes it can take a little bit longer, an hour to 2 hours. Again, it's best to work with somebody who's really familiar with the program, and those people can get you through faster. But again, if you wait till March 31st, we know that the website works a little bit slower when there's lots of volume. So it's best to start early and not wait till the last day, or there might be a little bit more frustration.
Absolutely. Even if it's only taking 20 minutes, don't wait till March 31st to do this, when we still have at least a couple more weeks here to get this all done.
19 days that nobody's counting.
Yeah, exactly. Exactly. You guys definitely counting. Now, as far as the states looking at this, how are you projecting the numbers will end up after March 31st? I know every state had to revise their estimates for how many people would actually sign up for health insurance because of kind of the federal problems that we had. But are we still looking at pretty good numbers, on track to enroll a lot of people in this?
Well, we're seeing a phenomenal amount of interest in the last few weeks. Our website hits are going up. Our call center it went over 600 for the first time since we started this program in the last 2 days. So we're really seeing that interest. So we're hoping to at least double our numbers by the end of March 31st.
Excellent. And again, we said 15,000 already had signed up through this. So a pretty good chunk of New Mexicans. And I did notice also that the Associated Press had reported that the number of uninsured has actually gone down nationwide. So New Mexico, we know, has had a huge problem with an uninsured population. Are we seeing a dent in that?
Well, we don't have all the figures yet back from the federal government, but that's our real hope. We know that the first people in line are usually the people who've had insurance because they've had that experience in the past. But now we're seeing a little bit more of the people who haven't been insured in the past too, and that's really where we're trying to make that difference.
James, is that a situation you guys are seeing too, trying to educate people who've never had insurance? I'm sure a lot of the people you've dealt with had insurance at some point in the past, but then there are these people who don't really know anything about it.
Exactly, and those individuals do take a little bit more time because you need to explain what a maximum out of pocket is, what a deductible is, what a coinsurance or a copay is. One of the things I did want to mention also is even after the open enrollment ends on the 31st, then there are certain individuals in certain circumstances where people can still enroll. Special election periods, if they were to get married or lose a job, or even the Native American community and small groups can also enroll outside of the open enrollment.
Yeah, actually, I wanted to bring that up. Native Americans are eligible for the New Mexico Health Exchange. Just and is that a unique group?
Well, one of the things that unique about that particular group is because the way that the Native American population has access to the facilities, it's very limited. Also, there's very limited benefits. So by enrolling in the exchange or the marketplace, they're actually be able to get expanded benefits and much greater access to healthcare facilities, and which in turn helps save tribes money also.
Excellent. That's the great information for them. And again, you know, as we talk about this, you mentioned some people may have special circumstances, but March 31st really is the last of it that we want to hit on. For the majority of people, that's correct, and I would not, as Deborah mentioned earlier, I would not wait until the end of March. Just like we experienced at the end of December, we had a great surge and we had a lot of slow and unresponsive problems with the website. So again, I would not wait until the very last minute because I'm sure that there's going to be, again, another surge. And
frustrations.
Yeah. Well, run us down quickly, Deborah, before the end here. What else is happening? We have the the hotline that I mentioned that KOB will be doing on March 25th. The call-in line, or the 24-hour line that you guys are running for questions. Anything else people should know about for help or questions answered?
Well, you talked about the texting to BWellNM at 311-401. That's just another platform that we're giving people. Again, but the best way is to look at the website. If you don't have access to the website, give our call center, 24-hour call center, a ring, and again, they answer within 15 seconds for the most part. So you're not going to be on hold for a long time. You're going to get that help fast.
Excellent. And I guess just a final push. I mean, why should people care about this right now? Why should people sign up for this?
Well, one, it is the law.
Besides avoiding the penalty, yes.
And there is a penalty, but really it's all about being well and taking care of your family. We insure our cars, we insure our houses. What's different about taking care of yourself and your loved ones? So we want to have people to have that security so they don't have to worry about any financial distress in the future.
Excellent. Well, Deborah Hammer from the New Mexico Health Insurance Exchange, and James Tomei from the insurance industry here helping explain this to us this morning. Thank you both.
Thank you for having us.
For being here. And we'll continue talking about this on the news for the next couple of weeks, I'm sure. Well, it is Selection Sunday, and coming up next on Eyewitness News 4 at 5, JP Murrieta and Lee Faria will host a special segment as we head into the NCAA tournament. This past week, Lee Faria was in Las Vegas for the Mountain West Conference tournament, and we wanted to take a moment to look back at some of the more memorable stories of the week. For example, when Lee caught up with the parents of Hugh Greenwood, who came all the way from Australia to root for the Lobos.
There's not too many things better than watching your kids play sports, but when you have to go halfway around the world to do it, now that's something special. Andre and Styx Greenwood have two kids playing for the Lobos basketball teams. Josie plays for the ladies team. Hugh plays for the men. Mom played hoops for the Australian national team. She says she taught Hugh everything he knows.
He was a little gym rat. He was always around the stadium. Then when I retired, I coached him all the way through up until under 14s.
Styx Greenwood says it's a scary thing to send your kids halfway around the world to play in a Division I college basketball program, but the way Lobo Nation has embraced his two children, he feels pleased.
And to go into a community where they are so loved, embraced, it is so relaxing and satisfying and peaceful for us to know all the way back in Tassie that our kids are safe and they're loved.
Mom and Dad were a little disappointed when the New Mexico women's basketball team made an early exit, but Hugh Greenwood and the men's team, they have a chance to pick up their spirits later in the week. In Las Vegas, I'm Lee Faria, KOB Eyewitness News 4.
And of course, every year the fans go to Vegas from New Mexico to cheer on the team. Lee caught up with them as well.
This is the South Point Hotel and Casino, the Lobos' home away from home when they're here in Las Vegas for the tournament. Right now, there's hundreds of Lobo fans here. By the time the men tip off on Thursday night, there will be thousands.
Everyone's a Lobo, baby. 444.
The Lobos. Lobo fans bought out Boise State. I talked to the actual ticket office lady yesterday. They bought out San Jose State, and they bought out Air Force.
Not only do the fans enjoy Las Vegas and the basketball, they like being close to the players, and for this week, they can do that.
It's a great venue. It's a great vacation. It's a great way to be personal, one-on-one with the Lobos.
Again, the Lobos will tip off on Thursday night, 7 o'clock Mountain Time. In Las Vegas, I'm Lee Faria, KOB Eyewitness News 4.
And again, keep it right here for Eyewitness News 4 at 5 up next, and a special Selection Sunday report with JP Murrieta and Lee Faria. That's going to do it for us here for Eye on New Mexico this Sunday. We'll see you back here next Sunday for another topic. Enjoy the rest of your weekend.